So I'm going to do an NG tube on this patient because the physician has ordered it for suction because the patient is constantly vomiting. So I'm going to get all my stuff and I'm going to go in the patient's room and wash my hands and put on gloves. I say, hi, I'm Carrington. I'm your nurse. I'm going to check your armband and what's your name and date of birth? And then I'm going to check the armband against that, and that's the same. So I'm going to ask if the patient has any allergies, and they don't. So I'm going to go ahead and give them this in case they need to throw up and put this over them. And I'm going to go ahead and I'm going to look in their mouth and in their nose to look for a deviated septum. I'm going to ask them if they've had any surgeries, no bleeding. So then I'm going to occlude each nair and ask them to breathe. And since this one can breathe fine, we're going to use the left nair. I'm going to go ahead and measure my tube. And I'm going to go from the tip of the nose to the earlobe. And then from the earlobe to the xiphoid process. It's going to get cold on me, of course it is. And so I'm going to go down there, and then I'm going to put some tape on that. So there's the tape, and it's right there. So I'm going to go ahead and give the patient a cup of water just in case we need it, and lubricate my jelly, or lubricate the tube, 4 inches. And I'm going to tell the patient we're about to start, and we're going to ask him to tilt his head back, and I'm going to put this one. And then once I get a few inches, we're going to go ahead and look in the back of the throat for coiling. The patient is not gagging, but if they were, then I would pull it back just a little bit, let them take a second and get a drink of water. And then once they're good, I'm going to tilt their head forward, and we're going to advance it until we get to the tape. On this mannequin it won't work, but on a real person it will go all the way to the tape. And I'm going to first attach it to their cheek, and then I'm going to check for placement. I'm going to make sure they can talk, and then I'm going to look in the back of the throat, just no coiling. And then I'm going to check for aspirant. If it was hospital policy, I would check the aspirant for pH, but I'm going to pull it back and I get some. So I'm going to go ahead and listen as I inject it back. To hear the swishing, and I did. So I'm going to take this off, and I'm going to go ahead and attach it to suction. And also a chest x-ray could be ordered for placement if the hospital wanted to do that. I'm going to go ahead and attach it to the nose. Make sure that's good. And then it's attached to the bridge of the nose too. And I'm going to have the patient turn their head away from me so that I can put it to the gown. Just so they have leeway that they can move their head while it's in. Okay, so they're good. I'm going to make sure that's going and it's attached to suction and everything. And then I'm going to clean up. And I would come back every 2 or 3 hours to provide mouth care for my patient. I'm going to ask them if they're comfortable, if they need to stay at least 30 degrees sitting up. My patient doesn't want to go. They have their call bell, and they have all their belongings. So then I'm going to leave the room, and later I'm going to document. I'm going to leave the room, and I'm going to document. And I'm going to document the time, the date, the tube length, and the size. The type of tube, and that we did it for suction for the vomiting. I'm going to write down the color and the consistency of the drainage, the client response. Our client tolerated this fine, and any instructions, and I'm going to record the drainage amount in the eyes and nose. I'm going to take off my gloves and wash my hands, and then when I need to come back and check for placement and irrigate, I'm going to come back and I'm going to wash my hands, and I'm going to put on gloves. I'm going to make sure everything's going fine, and I'm going to unplug this from suction, put this here, to, first I'm going to check placement just to make sure that it's still in the right place before we irrigate. So I'm going to bring back residual, and I have some. I'm going to reintroduce that, and I hear the swishing. So I'm going to get 30 milliliters of saline, and I'm going to introduce that in, and it will automatically bring back at least 30, but our patient brought back 40, so that means there was 10 of residual. So I'm going to discard of that, and I'm going to hook him back up to suction, and then I'm going to clean up, and I'm going to take off my gloves, wash my hands. He's got his call bell. I'm going to ask him if he's comfortable. And when I came in the room the second time, I wanted to check the armband and the allergies again just to make sure this was my right patient. And so I'm going to make sure he has his positions, and he's comfortable. He's sitting up how he wants to. He's still 30 degrees up. And I will clean all this up out of his room. And then I'm going to go and I'm going to document that I pushed in 30 of saline and I got back 40 milliliters. So there's 10 milliliters of residual. I'm going to document the type and amount of the saline solution, the difference in volume, the characteristics of the return residual, the fact that we had no difficulties irrigating the tube, the client tolerated it great, and any teaching I